Apart from that, we do all the routine dentistry. We do have orthodontists with us. We do Invisalign cases, aligner cases.
You exhibit Delegation as well?
Yes.
That's right, okay.
We do a lot of patients who fly in from Chicago, USA, from parts of USA, Chicago. To my place, especially California. Then we have a lot of patients coming in from Dubai, UK, Australia.
एक मिनट
Okay. So this is a very special equipment that we have, which is called a P5 Neutron. It has all the surgical modes, so it's very pain-free and comfortable for a patient. Okay, so we have included in the chair. So 2 chairs are the purpose that a lot of times I am working, or I might have a fellow doctor with me working.
So when you are doing procedures, you are doing it?
Usually I am attending one long procedure to the patient alone. We try and maintain that privacy for the patients, so that it gets awkward for the patient to open a mouth when you see 2-3 people sitting around you. So we avoid that. One doctor is going to be there. I will be treating the main patient. We have a sitting place for the relatives or the spouse or the parents who are coming in, waiting for them. Sometimes when we have an emergency situation or we just have to quick checkup, we use the second chair, and somebody who's coming along can sit there with the person. Yeah. So this is Indian Dental Association Awards. We've got a lot of awards throughout our journey when I was clearing all my exams and my degrees. And my thesis was back in 2016, and the Indian Dental Association awarded me the best thesis of the year.
Wow.
So,
This one?
awards. Yeah. All three of them are And so similarly, we have 2 chairs for privacy, comfort, and still we can take care of both the patients. I will explain a little bit about the sterilization protocols that we take care of. Yeah. The head caps, they are discarded with every procedure and patient, and new films are attached, because usually when we are wearing gloves, we tend to touch the surfaces. So that causes cross-contamination if we don't change it. Right? If I am touching this for a procedure, and then again I am touching it with my gloves, the gloves are going to have saliva or blood from the mouth. So all of these things are discarded. We put a new film every time. The entire chair and the area is disinfected, and then only a second patient comes into play. Along with that, more or less all the instruments that we use, whether surgical or non-surgical, are packed into proper packets. So they are packed, they are sealed, and then they go into autoclaving, sterilization. With every patient, we discard the packets, so new packets for new patients. So sterilization is properly maintained. Yeah. No instrument is used twice. Whatever is disposable is thrown. Right? Like suction tips, glasses, drapes that we use are all disposable, so they are all discarded.
So, Mr. Alex, if any dental patients, this is the base place, you can take it. I see. It's very
Also, one last add-on would be you can show them the laser. The sterilization process that we use is equivalent to how it is done in OTs. OT has a bigger machine, we have a smaller machine here. So it's a class B sterilizer. Yeah, so this process is going to start. Okay, so we have loaded the instruments like this. They will be checked, they will be loaded, and then they will go inside. Right? So, sterilized instrument. So this is a complete dry mechanism. Yes. You put in dry instruments, and the dry instruments, it's a steam vaporized, all sterilization is done, and it comes in dry. So like see, when it's steamed, it turns brown. This is sterilized. Okay, when you use this, it's thrown. Then you use a new one.
Oh.
So when I open this and I throw this, it's thrown, then a new one. So the instruments will be clean, they will be sealed, they will be autoclaved, and then will be used. Right? So we have special equipments for how we put dental implants. We have to drill the bone, put the implants. I have the entire setup. I do it for all the patients. Usually the implant system that we use is very much standard internationally. All the labels, all the details are given to the patient, and those equipments, it's not like some random Korean or Israeli brand. These are very worldwide certified brands that we use for implants. So later on, maybe 5-10 years down the line, once the treatment is done and the patient suddenly has some issue and wants to show it to some doctor, then this is a worldwide known system. So there's no question mark about, oh, how will we get a part, how will we get a screw, now what do we do? This is something that's gold standard. It's been used for over 20-30 years in the world in dentistry. We also have intraoral scanner. So all the cases are scanned. We don't do a lot of manual process now. So everything that we do is scanned intraorally. So if you had... Yeah, sure.
So this is where they take care of all hygiene, sterilization, so no infection to patient.
So you can ask me all questions.
I was asking
if you want to see cases, I can show you a couple of cases also.
Okay, let's wait first. I was asking about the after procedure. Where do you if a patient were to have a wet list to after procedure?
So usually dental procedures don't need in-house admission. Okay, you don't need to get admitted like you need to get admitted in a hospital. The patient can easily walk out after the procedure. It's not that